Myself Preeti Sharma from AKtU College of Pharmacy, Ghaziabad. Today I will going to discuss a topic that is preventive medicines. What are the general introduction of preventive medicine or how we can prevent the disease. So what is health? So everybody knows that health is a disease of complete physical, mental and social well-being, and it is not merely the absence of disease. This is basically the definition which is given by the WHO, World Health Organization, and some of the factors which is related to a disease, that is host, agent, environment and the vectors. So what is preventive medicines? Here I given the aim of learning preventive medicines. So first of all we have to understand what is preventive medicines. Preventive medicines is a medical specialist recognized by the American Board of Specialists by the USA, and it is basically focusing on the health of an individual and the communities. Basically we are focusing on the promotion of health and the well-beings, and how we can improve or how we can prevent the disabilities and the death. So first one is to establish the idea of prevention first, and it could be a strategy of 3 prevention levels to deal with the health related problems, to understand the relationship between the environments and the health and the harmfulness of major environmental factors. Here I will discuss the 3 prevention level. In the further slides I will discuss here the primary prevention, secondary prevention and the tertiary prevention, how we can prevent the disease. And its main we can say the aim of this learning the preventive medicine to know the basic theory and the skill to prevent the disease and promote the health of an individual and the populations. Now here I given the word epidemiology. Epidemiology means it is a branch of medicines which deals with the incidence, distributions and the possible control of disease, how we can control the disease by distributing and determinants of health related status, or we can say the various health events in specific population. And the application of this study, we are basically focusing on the control of health problems. Now here the prevention of disease, the outcome of any investigation. First of all, to prevent any disease, first of all we are seeing the we are screening the particular disease, then we are saying that how we can prevent. Suppose we are taking an example of tuberculosis, we have to prevent the tuberculosis, then we have to first of all we have to screen the disease and then we have to give a particular treatment. I will tell you primary treatment, secondary and tertiary treatment, what are the difference between the primary, secondary and tertiary treatment in the further slides. So first of all, to prevent any particular disease we have to screen out, the disease, and then only we are thinking what type of treatment is given to a particular patients. So here the outcome of any investigations on risk is to determine what can be done to reduce the health risk within a population, and this basically decline in death rate that occurred during the 19th century in high income countries was basically due to the decrease in death from the infectious disease. Most of the decline we can see the mortality rate took place before the specific disease, and the basic prevention intervention we can say here the attribution to improve in nutrition, housing, sanitization and other environmental healths. Now the another case we have seen in the 20th century, the decline in death rate from cardiovascular disease have accelerated in high income countries. Basically we are seeing here the gradual prevention of disease, how in the 20th century there will be a decline in death rate from cardiovascular disease. And next we are seeing the gain have been result of wide range measures. We are detected the whole population and individual how we can prevent the disease. This is a graph. You can see here the graph of preventive the tuberculosis, age standardization death rate from tuberculosis in England and Wales. We have seen in 1840 to 1968. You can see the first of all we screen out the tuberculosis. You can see here in the graph that tuberculosis is identified in the first treatment, or we can say in the primary treatment. If we are going to give a treatment to any particular patient, first of all we have to do the first step, that is screening. Screen the particular disease. Suppose here I given the example of tuberculosis, and then we are preventing, and we are saying that we can control the disease by giving the chemotherapy, means tuberculosis, or basically the BCG vaccines. If we give a vaccine to a particular patients, and or we can say the chemotherapy, means chemically we are giving directly a drug to a particular patient to whom we are screening out. So now these are some social determinants of health, condition in which the people live and work. Addressing the social determinant of health is the fairest way to improve the health for all the peoples. Now here the good medical care is very vital, but the factor that can undermine the people's health, such as social position, housing the condition, and occupational risk, needed to be addressed. Now these are some level of preventions. There are 4 level of preventions. Each level targets the conditions which have an established role in causing the disease. Approaches to prevent overlap and emerges. First one is primordial, second is primary prevention, third is secondary prevention, and fourth one is tertiary preventions. So primordial preventions, I will here discuss the aim, target and the action of the primordial prevention. Same with the primary, secondary and the tertiary. Secondary and tertiary prevention are generally focused on the people who already have the sign of a particular disease. For example, diabetes or diabetic retinopathy. These are some examples. Here you can see the preclinical and clinical phases. Preclinical phases means before the diagnosis, means the biological onset of disease till the diagnosis. Before the diagnosis we can consider as a preclinical phase, and in the diagnosis and the treatment will come under the clinical phase. Means after diagnosing a disease we can give a particular treatment or particular drug to a patient, then it's come under the clinical phase. In the preclinical phase, here the biological onset of disease, and next is pathophysiology, evidence of disease can be seen, and now the next one is sign and symptoms of a disease can be seen. Now in the clinical phase there will be a seek medical care, diagnosis and the treatment, and at last you can see here the outcomes, that is cure, control, disability and the death. Here the primordial preventions, it avoid the emergence and establishment of social, economic and cultural pattern of living that are known to contribute to an elevated risk of disease. Basically here socially we are preventing a particular disease, means the risk factors, we are trying to avoid the risk factor with the help of primordial preventions, means we are socially, economically and culturally we are focusing on the elevated risk of disease. Now, this is a graph. You can see here inverse relationship between the real price of cigarette and cigarette consumption in the South Africa in 1961 to 2001. Now, here the primordial you can see the phases of disease, underlying economic, social and environmental conditions leading to the cautions, and the aim of the primordial is establishment and maintain the condition that minimize the hazards to health. Basically, the biological actions of this primordial prevention, we can say we measure the inhibition of environmental, economic and social behavior conditions. We are basically inhibiting these measures socially, economically, behaviorally and environmental conditions we are inhibiting, means we are ultimately we focus on the or we are promoting the health of a particular patients, or we are doing the preventions of a particular disease. And here the target is total population or the selected groups achieved through public health policies and the health promotions. Means totally if we are targeting a total population or the selected group of peoples we are taking, and we are suppose if we have to make a trial on a particular disease, means first of all we have to trial that particular drug on the small group of population, then we are seeing that this is a disease which can be prevent, or we can examine our data, examining the results that it is fit for this particular disease. So, this is the target on the total population we can use, or in the selected groups, or it may be achieved through public health policies and the health promotions. Now, this is a primary prevention. To limit the incidence of disease by controlling a specific cause and the risk factors, primary prevention, the word itself define here, the primary means at the starting point or the first treatment given to a patient is known as primary prevention, or that come under the primary preventions, means the first treatment which is given to a patient, that's come under the primary prevention. And the whole population with the aim of reducing average risk, the population or the mass strategy. Primary prevention means, as I told you, first treatment given for a disease, and it may be basically such as for the surgery followed by the chemotherapy and radiations. These are some example. People at high risk as a result of particular exposure, the highest risk individuals. Now, these are the level, phase of disease, aim, action and the target of this primary prevention. So, phases of disease, specific causal factors, these are the phases of this or we can say the first treatment given to a patient. This comes under the phases of disease. Now, the next is aim, reduce the incidence of disease. Now, the next is action, protection of basically the biological action, or we can say how we can prevent the disease, protecting of health by personal and communicable efforts such as enhancing nutritional status, and we are providing the immunization and eliminating the environmental risk. We are providing the nutritional status to each and every patients, So, this is one of the most important factors here. And total population, selected groups and individual at high risk achieve through public health programs. Now, these are some advantage and disadvantage. Radical, these are some advantage of the primary prevention. First one is the radicals and the large potential for the whole populations, behaviorally appropriate. And for the high risk individual strategy, appropriate for individual and the subject motivation. Subject here we are saying to the patients. Patient motivation is much and more important. And now the next one is disadvantage, small benefit to individual and poor motivation of subject. In the population strategy, we are discussing about the disadvantage of poor motivation of physicians in the population strategy, and benefit to risk ratio may be very low. And in the case of high risk individual strategy, here there will be a difficulties in identifying a high risk individual, temporary effect, limited effect and behavior appropriate. Now, this is a secondary prevention to reduce the more serious consciousness of a disease through the early diagnosis and treatment. Means in secondary prevention we can say before the seriousness or before the worsening of a patient condition, we are giving a treatment that is comes under the secondary preventions, or we are trying to detect a disease earlier and prevent it from getting worsened, that is called secondary prevention. Now, this is the phases of disease, secondary, early stage of disease. Now, the aim to reduce the prevalence of disease by shortening its duration. Now, its action is to measure available to individual and communities for early detection and prompt interventions to control the disease and minimize disabilities and the screening. Now, these are some targets. Individual with established disease achieved through early diagnosis and the treatment. Now, here some of the examples we can say here about the secondary preventions. Means detecting the mammogram for the, here I will discuss here one example of secondary preventions. With the help of mammogram, we are detecting the breast cancer earlier before the worsening of a conditions. We are detecting means we are screening. Now, this is a requirement of secondary preventions. First one is safe and accurate method of detecting the disease. Second is effective method of interventions. Now, before I told you that screening is must, means screening means diagnosis of a disease or the process of using test on a large scale to identify the presence of disease in healthy people is must. So, you can see here the biological onset of disease in the length basis, or you can see in this scale that there will in 2000 you can see the biological onset of disease in a patient, but we have diagnosed and treated that sign and symptoms is occur in the patients in between the 2000 to 2008, but we diagnose means we screen out the disease in the 2000. These are the types of screening: mass screening for the whole population, multiple uses several screening tests. At the same time, target screening, you can see a group of people with specific exposure, and case study, you can see that doctors will give a test, means you have to do the test in the case finding. These are some criteria for the screening. Now, this is a report, or we can say the screen test. means whether if we are detecting any particular disease, then we are getting that it is a positive or negative. Test is positive or negative. This is ultimately we can say it is a report of a patient. Here you can see, earlier I told you the biological onset of disease between 2000 to 2008, and ultimately you can see here in this scale in 2010, the gap of 2008 to 2010 there will be a survival period. Now at last is tertiary, yeah, we can say ki primary, secondary. Now the last one is tertiary prevention, to reduce the progression or the complication of established disease, and the important aspects of therapeutical and rehabilitation medicines. And in the tertiary prevention we are saying that it is managing a chronic disease. If we are managing a chronic disease, for example cancer or the stroke rehabilitations, if we are managing a disease, that comes under the tertiary prevention. Now these are the levels. Late stage of disease is the tertiary disease, a tertiary prevention, that is tertiary prevention. And now here the aim is to reduce the number or the impact of complications. Action is measure the aim at softening the impact of long term disease and disabilities, minimizing these sufferings and maximizing the potential year of useful life. Now these are some targets. We are targeting the patients. Now there is a difference between primary. Primary, as I told you, it is a first treatment we are giving to our patients. Secondary means before worsening the condition or before worsening the situation, we are giving a treatment that is come under the secondary prevention. And tertiary, at last we are managing the disease, for example cardiac or stroke, it is come under the tertiary prevention. So these are some general introduction of preventive medicine which I told you in the 3 levels, primary, secondary and tertiary, and the screening is much and more important, that is diagnosis. We can diagnose a disease by screening out the test of a particular patient, which I have you given in here the test report. This is a test report which can conclude the test whether it is positive, negative, what will be the result of the screening, and after screening only we can give the treatment to a particular patient, whether we have to give the first treatment means primary treatment, secondary treatment or either the tertiary treatment. So it is basically depend upon the screening. These are some references which I quote here in the some of the review papers here, which I given you the references. Thank you for the patience listening.